Hello, everyone, and thank you for joining us for today's webinar. I wanted to go over a couple of housekeeping notes before we begin. In this platform, all attendees are muted. While you won't be able to ask questions through audio, please note the Q&A function on your screen. If you have a question that is not addressed in the presentation, feel free to submit through the Q&A feature and our presenter will try to address as many as possible at the end. Also, today's webinar is being recorded and will be posted on our website. As a registrant of today's session, you will receive an email with the link once it's live. It is now my pleasure to introduce our presenter for this session. Dr. Kelly Manger is a family practice physician at UH Willowick Health Center, where she sees patients of all ages. Her special medical interests include adolescent medicine, dermatology, preventative health, and women's health. I will now turn it over to her.
Hi, thank you, Amanda. I'm Dr. Kelly Manger. Thank you all for joining me today. We're going to be talking about blood pressure, which is something that we are all familiar with, at least, passively when we go to the clinic and get the cuff put on our arm. And a lot of us, are used to kind of having that procedure done, but maybe don't know what it means. As we'll talk about, a lot of people at some point, either themselves or friends, family members, are going to be told that they have elevated blood pressure or hypertension at some point. And so we're going to kind of talk about what that means, the implications of that, and what you can do to keep your blood pressure where it should be. So I'm really looking forward to talking to all of you guys this afternoon. Like Amanda said, if you guys have any questions, please put them in the Q&A box and we'll get to as many as we can at the end. Okay. So we're going to kind of go through blood pressure in the old-fashioned who, what, when, where, why, how format. So starting with who is affected by high blood pressure. So it's extremely common. So almost half of the adult population in the United States, 108 million adults, are affected by high blood pressure, and only a very small proportion, about a quarter, 24% of those people that have high blood pressure are keeping their blood pressure well controlled. And we'll kind of talk about what well controlled means and all of that in a couple of slides. This is important because high blood pressure is a high cause of morbidity and mortality. And what that means is it can contribute to worsening of other heart conditions, heart disease, congestive heart failure, things like that. And it is a contributing factor or listed as the primary factor for cause of death in many people. So the statistics for 2018, high blood pressure was listed as the primary or contributing cause of death for nearly 500,000 people, 494,873. Not only is blood pressure in and of itself considered a risk factor, but as I mentioned, having high blood pressure also can increase your risk for other negative health effects, including having heart attacks, stroke, and both of those two things are two additional causes, leading causes of death in the United States. So there's a lot of reasons to pay attention to high blood pressure and to try to keep those numbers as good as possible. So that kind of leads us to our next question. Obviously, a lot of people are affected by blood pressure, but what is blood pressure? So again, it's something that most of us are familiar with. We get our arm squeezed at the doctor's office, they rattle off some numbers, but what does that actually mean? What are we talking about when we're giving those numbers? So the first thing I want you to think about with blood pressure is kind of go back to the heart. So what is the heart? The heart is a muscular pump. That's all it is. All the heart does is it's just pumping your blood throughout your body. It's taking blood, pumping it to your brain, your kidneys, your liver, your organs, all your muscles. It's just kind of moving that blood through your system. And if you think about, what you feel when you feel your own heart in your chest, it kind of has two motions, right? It's pumping or it's relaxed, pumping or relaxed. And so you can kind of see that in the animation there. And so in thinking of kind of those two modes of the heart, whether it's pumped and contracting or relaxed, blood pressure also has two numbers, two values associated with it. And usually people hear those numbers as, one number over another number. So maybe like 120 over 80 or things like that. And what those two numbers represent are the pressure in the arteries when the heart is pumping, when it's contracting, and when the heart muscle is relaxed. And your arteries are kind of the tubes, the vessels that carry your blood throughout the body. So the heart is the pump, and then the arteries are the tubes that are taking the blood to where they need to go. And so those two numbers are just representing the pressure in those arteries during those two different kind of movements of the heart. And so the top number represents when the heart is pumping, and then the bottom number represents when the heart is relaxed. So when the heart is pumping, that's when the pressure is going to be the highest. And then when the heart is relaxed, that's when the pressure is going to be the lowest. And again, normally your doctor will say something like, oh, your blood pressure is 120 over 80, 130 over 76. That's what they're referring to. The medical term for these two values are the systolic pressure for the top number and the diastolic pressure for the bottom number. So now that we know kind of what those numbers mean, let's talk a little bit about what those numbers should be. So here's a nice table from the American Heart Association. So we can see different blood pressure categories on the left, and then kind of our goal values. So normal blood pressure is still considered less than 120 for the top number, for the systolic number, or less than 80 for the bottom number or the diastolic number. And that's represented by that green row right at the top there. We start to consider you as having elevated blood pressure if your top number goes higher into the 120s or greater than 80. And then we consider you to have high blood pressure or hypertension when that top number is 130 or above, or the bottom number is greater than 80. And if we keep going, worsening stages of hypertension would be that top number being 140 or higher, with the bottom number being 90 or higher, or hypertensive crisis, meaning that you would need to go contact your doctor immediately or go to the emergency room if you saw numbers higher than 180 for the top number or 120 for the bottom number. The concern with that is that you can actually have damage to your organs, can have some really long-lasting serious effects, risk of stroke, heart attack, things like that when you start seeing pressures that high. So the kind of most important column in terms of treatment is this orange, not column, orange row right here. So this is the point when your doctor will likely want to start treating you for high blood pressure. And that treatment could be either with, lifestyle interventions or medication or things like that. But this is usually the point where most guidelines say that we need to actively be doing something to get your blood pressure lower. And again, that's if the top number is greater than 130 or the bottom number is greater than 80. There used to be, different kind of guidelines. People would say, oh, the top number is more important, the systolic pressure is more important, or the diastolic pressure is more important. Really both of these are considered very important, and we pay attention to both of them when we're monitoring blood pressures and we're checking blood pressures. The only kind of caveat I'll add to this table is that this is always a conversation that you should be having with your physician in terms of what your goal blood pressure value should be. just because of different health conditions, age, other medications you're taking. All of those might affect and change what our goal blood pressure is for you. But in general, broad strokes, these are kind of what we consider blood pressure categories. So when is high blood pressure diagnosed? Oftentimes it's just an incidental finding at routine visits. So most doctor's appointments, you get your blood pressure checked and happen to notice that your blood pressure is high. It's very often asymptomatic. So most people can walk around with moderately high blood pressure and not even know it. And so that's why it's really important to go to your regular checkup, see your doctor regularly, because this isn't something that you're necessarily going to feel or notice yourself. If you do have extremely high blood pressure values, you can have symptoms. So of course, things like chest pain, pressure, headaches, vision changes, those are signs and symptoms that are associated with extremely high blood pressures and again would warrant urgent evaluation. But very often people just have high blood pressure and it's something that gets caught when they're coming into clinic for something else, either their routine physical or some other complaint. And it's important, again, just to kind of go back to the previous slide, even if you're feeling fine, if you're told that you have high blood pressure, we will want to treat it. And the reason for that is, even if it's not causing you symptoms in the moment, we know that long-term having those high blood pressure values can have negative effects for your health. So again, thinking of your heart as a pump, a muscular pump, your heart's just a muscle like any other muscle in your body. Every pump that it has to do against higher blood pressure is making it work harder than it should, than it needs to. So like any muscle, it might be able to work harder for a little bit of time, right? It might be okay today, it might be okay tomorrow, might be okay for the next week or two. But, if you're someone in your 30s or 40s with, decades of life ahead of you, your heart, decades and decades of beating against that higher pressure is going to wear out. It's going to fatigue, and you're going to have, long-term effects of your heart having to beat against that high blood pressure over long periods of time. So even if you have zero symptoms from your high blood pressure, it's really important that it gets treated and is monitored and is under control. So continuing on when high blood pressure is diagnosed, just in general, your risk of high blood pressure increases with age. So like most parts of our body, our veins, our arteries get a little bit stiffer as we age over time, and they're a little bit less flexible. And so that can cause blood pressure to increase. 90% of Americans at some point in their life will be diagnosed with high blood pressure. So it is extremely common. And oftentimes it's not a matter of if, but when. Not always. Again, not everybody develops high blood pressure, but the majority of people do. Earlier in life, until around age 45, it's more common in men. In middle age, it's pretty even between the two sexes. Men and women have high blood pressure at approximately equal rates. And then by age 65, it becomes more common in women. And then this is just kind of an interesting graph. So where geographically is high blood pressure a problem? So it is certainly an issue across the United States, but you can see, in the Midwest, in the South and East, those darker reddish orange colors are correlating with increased prevalence. So I'm assuming most of you attending this University Hospitals event are probably in the Ohio Cleveland, greater Cleveland area. So you can see that we do have a particularly high rate of blood pressure in our area. Next question, why? Why do people get high blood pressure? And this is not always an easy question. And as you're going to see in a couple seconds here, there are a lot of potential answers to this question. There's a lot of causes, and sometimes we don't really identify one at all. So we're just going to go through a list here, and this is by no means even all of the potential causes, but just to give you guys an idea. So genetics, family history. Oftentimes, you know, if you have other family members, parents, siblings with high blood pressure, that will increase your risk of getting high blood pressure eventually as well. Age, we kind of addressed that a couple of minutes ago. Just your vasculature kind of stiffens with time, and that can contribute to elevated blood pressure readings also. Diabetes is also a risk factor for elevated blood pressure. Kidney disease, your kidneys are involved in kind of like a hormone cascade that involves, you know, blood pressure dilation and things like, or excuse me, blood vessel dilation and sodium, potassium, electrolyte balance, and people with kidney disease can also be at risk for high blood pressure. Also, thyroid, adrenal, or other hormones, if those are imbalanced, can also contribute to elevated blood pressure readings. Diet, we're going to be talking specifically about diet in a little bit here, but particularly excess salt for some people can increase their blood pressure readings as well. Tobacco, alcohol, and other drug use are certainly big contributors. You know, if any of my patients that are current smokers, I always encourage either they cut back smoking or consider quitting for many reasons. But, you know, one of the many, many benefits of quitting smoking is that it does have a significant impact on blood pressure. Nicotine in cigarettes and tobacco can significantly raise your blood pressure. So, you know, in addition to most of the medications, almost anything I can do for you in clinic, you quitting smoking can almost have the biggest impact on your health overall for blood pressure, cancer risk, all of those things. So for many reasons, I always encourage smoking cessation. Excessive alcohol use can also raise blood pressure. We'll talk a little bit about that more later. And then obviously drug use. Obesity is also associated with elevated blood pressure. Pregnancy, we could do a whole other presentation on just issues in pregnancy, but it's a particularly concerning issue in pregnant women. So your obstetrician will monitor your blood pressure very closely and can be associated with other conditions called preeclampsia. Eclampsia can potentially be very serious. So it's something kind of unique in pregnancy, but that's another cause. Medications are another very common contributor of elevated blood pressure. So things to look out for that might be raising your blood pressure include nasal decongestants, steroids, weight loss aids, stimulants, and others. So nasal decongestants, be particularly careful of over-the-counter medications like Sudafed or any of the allergy medications that have the letter D at the end of their name. So things like Claritin D, Zyrtec D, all of those have the Sudafed component in with the regular allergy medication, and in particular can raise your blood pressure. So be careful with those. Weight loss aids usually contain some sort of stimulant as well, which will also raise your blood pressure. And then when I mentioned stimulants, that often is referring to weight loss aids, but also ADHD meds, those kinds of things. Stress and anxiety is another common cause. There's something that you guys may have heard of called white coat hypertension, meaning that sometimes just coming to see us in the office can be anxiety inducing for a lot of people. So if you suspect that that's a contributing factor for why your blood pressures may be high in the office, I always encourage people to get a home blood pressure monitor so you can kind of check on your own. And, we can kind of see, how the numbers in our office compare with what you're getting at home. And we can also help make sure that you know how to use the machine and calibrate it right. And also often over time, as you get to know your doctor and get comfortable with each other, that kind of white coat hypertension anxiety can get better with time too. So a lot of potential causes, but oftentimes there's actually not like one clear underlying cause for people. And so if it's not obviously secondary to something else, we just call this essential hypertension. So you might see that, on your medical chart or things like that. And that just means that you have hypertension and there's not a clear underlying reason. So now that we know what hypertension is, what high blood pressure is, what it means, what can cause it, now let's talk a little bit about what we can do about it. And there's actually quite a bit. So that's what we're going to be talking about for the next several slides. So how can I treat my blood pressure? So like I mentioned in the previous slide, salt is one of the biggest dietary factors that you can try to adjust in controlling your blood pressure. So salt, I always encourage you to think of as not just what comes out of the salt shaker, but also remember that salt is added in a lot of other foods, a lot of processed foods as well. So even if you're not adding any salt, depending on the other food choices you're making, your sodium intake can be quite high. So a good goal, just in general, is usually to try to consume less than 2,500 milligrams daily. And so where you're going to find that is on the nutrition label of foods under sodium. So sodium is just another word for salt. And, it should say how many per serving, how many milligrams per serving of sodium, and that should be your total for the day. Again, this is something good to talk to your physician, your nutritionist specifically, because sometimes this recommendation might change with other health conditions you have. And so if that number is different than what your physician has told you, I would obviously follow what they recommended. But in general, for high blood pressure, in the absence of any other health issues, that's a good guideline. And this is what I just talked about. Remember that salt doesn't just come from the salt shaker. Common culprits of high sodium foods are frozen meals, canned soups, actually anything that comes out of a can can be high in salt, and lunch meats. And the next slide here, one more. Restaurants also use much more salt in their cooking. So oftentimes that's why food can taste so much better at a restaurant, is because they're adding a lot more salt than people tend to when you cook at home. So this is the next slide that I wanted to show you. So this is just kind of showing sodium content in a lot of common foods. So the further those little yellow bars are to the right, the more sodium they contain or the more salt they contain. And I kind of circled the high values here. So if you notice canned or frozen vegetables with sauce, or pasta sauce that's in a can or a jar, canned beans, turkey breast, lunch meat, lean ham. So a lot of like processed meats, canned vegetables, or like jarred pasta sauces are all very high. And it's hard to make adjustments for like a sauce or something, like for pasta sauce. But remember that sometimes with canned foods, you can lower their sodium content. So if you have a can of beans, for example, a really easy way to lower that sodium value is just to rinse them. So take the can of beans, rinse them a few times before you use them, and then by washing off that liquid that they're in, you've already lowered a lot of the sodium content from what's listed on the can or what's listed there. Moving on, what else can we do to treat our high blood pressure? In addition to just lowering sodium, there's also a specific diet called the DASH diet that has been clinically shown to have positive effects on lowering blood pressure. So DASH stands for Dietary Approaches to Stop Hypertension. And it is less specific guidelines. I'm not going to list numbers of sodium or milligrams or things like that. But oftentimes it's just kind of general nutrition advice that's been associated with positive impact on high blood pressure. So in general, with the DASH diet, we're incorporating a high amount of vegetables, fruits, and whole grains. So there's a nice picture of that. We're also focusing on lean meats like fish and poultry, beans, nuts, vegetable oils. Some studies suggest low-fat dairy. That's a little bit more controversial in terms of that one in particular's true impact. And then also limiting high saturated fat foods. So, fatty meats, red meat, full fat dairy, and coconut oil. Also limiting foods high in sugar. So that includes, sweets, obviously, also high sugar beverages such as juice and soda. One benefit of this is it not only has been shown to help blood pressure, but also has benefits to many other health issues as well. So these changes can also lower cholesterol, particularly your LDL or your bad cholesterol, and that also can further reduce your risk of heart disease. So reducing your blood pressure reduces your risk, and then this will also decrease your cholesterol, which further reduces your risk. So multiple heart healthy benefits. And if any of you are familiar with like the Mediterranean diet, the principles of the DASH diet are very, very similar. Going on to how I can treat my high blood pressure. Again, quitting smoking. So we talked about this before also. So one of the biggest impacts you can have on your health, not just for high blood pressure. Also limiting alcohol. So current guidelines are for women to not exceed an average of 1 drink daily or 7 drinks per week, or 2 drinks daily or 14 drinks per week for men. And when I say drink, we're talking a typical serving size. So, 12 ounces of beer, a glass of wine, or the equivalent of about a shot or of 1.5 ounces of liquor would be considered 1 drink serving. So 7 for women, 14 for men. There's actually some building evidence that recommendation for men should actually be lowered to 1 drink daily as well. And this isn't certain. This certainly isn't, I'm not telling you to drink this much, but certainly not to exceed it if you are trying to monitor your blood pressure. Also, exercise can have a huge benefit on blood pressure and also just general cardiovascular health. Exercise can also improve your weight. Obesity, as we mentioned earlier, is another risk factor for high blood pressure. So for exercise, we recommend 2.5 hours of what we consider moderate intensity aerobic exercise for all adults. And that's just recommended for everybody, regardless of whether you have high blood pressure. But that's especially important in terms of if you're not doing that, that's something that can improve your blood pressure as well. Examples of moderate intensity aerobic exercise would be walking briskly, bicycling, dancing. That's one of my personal favorites. Swimming, water aerobics. And also it's recommended that you add some sort of strength training at least 2 days a week. And the reason why I listed a lot of those exercise examples is because they're things that you don't necessarily need a gym membership for. You know, you can go on a walk in your neighborhood, go on a bike ride in the park. You know, we're fortunate to have the metro parks in the area here that are just beautiful. You know, you can dance alone in your living room. None of these require, you know, an expensive gym membership. And you can meet that, you know, requirement, the recommendation for heart healthy aerobic exercise, even if you don't have the resources or the transportation to kind of go to the gym or other options. Also, though, sometimes, especially if you're not active or not exercising at all, remember that any amount of physical activity is beneficial and it's a good place to start. Okay. So, you know, if you're not at 2.5 hours per week, you know, start what you can. Go, you know, on a 10-minute walk every day or see what you can tolerate and just go from there. Anything is better than nothing. And so sometimes I think those numbers can look intimidating to people and people say, oh, I could never do that. But just start somewhere and, you know, find some kind of activity that you enjoy. And, you know, you can work up to that 2.5 hour goal, but any amount of physical activity is a good place to start. Bonus, again, exercise obviously has a lot of other health benefits in addition to improving your high blood pressure. So it reduces your risk for diabetes, heart disease, stroke. It can improve sleep. Exercise, particularly strength training, weight bearing, can improve bone density or prevent development of osteoporosis. It can improve mood, help with depression, anxiety, and many other benefits. So lots of reasons to encourage exercise and physical activity. So those are kind of some of the main lifestyle recommendations for high blood pressure. So now I'm going to talk a little bit about medications. And we're just going to go through kind of some of the major classes. I'm not going to go into too much detail, but some of you here today who maybe are already on blood pressure medications or who have had these conversations with your physician might recognize some of these. So it might be helpful to kind of just go through them quickly. So the first kind of general class are called calcium channel blockers. So common medications in this class would be amlodipine or nifedipine. And how they work is they reduce your blood pressure by relaxing the muscles that line the walls of your artery. So I have a little diagram here. So again, going back to our picture of the heart earlier, the heart's the pump, the arteries are the tubes, the vessels that carry the blood to the rest of your body. And the tubes are lined with muscle. And so that's how your arteries expand and contract, is that those muscles kind of expand and narrow the opening. So that would be constriction, you can see right here, or they can dilate and the muscle layer thins out. And so what these medications do is they decrease the pressure by relaxing this muscle that lines your artery so that the pressure is less. And my favorite analogy when I think about this is if you ever played with a garden hose when you were a kid, if you narrow the opening of the garden hose with your thumb, the pressure increases, so the water comes out really quickly, where if you take your thumb off the pressure goes down and the water comes out more slowly. So that's kind of what these medications are doing. They're narrowing the opening, or sorry, they're expanding the opening and reducing the pressure that way. Common side effect is feet and ankle swelling. So that's something to look out for. And these are considered first-line treatment, so they're a good option for a lot of people. Again, it's a conversation that you should have with your doctor, but it is one of the more common medications that we give as kind of primary treatment for elevated blood pressure. Reasons why this might not be a good medication option for you are things like aortic stenosis, which is a specific issue with your heart valves, and then liver disease. Another type of medication is called an ACE inhibitor. And examples maybe you've heard of for this kind of medication are like lisinopril, ramipril, enalapril, also very common. These work on kind of an enzymatic pathway that constricts your blood vessels. So they inhibit part of that pathway. So that pathway cannot constrict your blood vessels and kind of relaxes them, just like we looked at in that previous picture. So same end effect, but works a little bit differently. One of the most common side effects of these medications is a dry cough. And so oftentimes, people will be started on these medications and it's just kind of this dry, nagging cough that we can't attribute to anything else. They didn't have it before, and can be the result of this medication. It's a good option for many people. It's one of the first-line treatments. It's also particularly beneficial for diabetics. It can be kidney protective for diabetic individuals. People who should be careful or who might not want this medication as a first option would be people with kidney disease or also history of high potassium, because these kind of medications can also raise your potassium levels. Similar kind of related type of medication are the ARBs, or angiotensin receptor blockers. And these you've maybe heard of, like losartan or valsartan. They essentially work on that same pathway as the ACE inhibitors that we talked about before, but they have a very considerable benefit in that they do not cause a cough. So oftentimes we will switch people that have a cough with lisinopril or one of these other medications to one of these other medications like losartan, and we can get the same benefit, essentially have the same effect in terms of their physiology without that side effect. And the final kind of mainstay of treatment, meaning like first line treatment for just essential hypertension, are diuretics. And so examples of these medications are hydrochlorothiazide. That one's kind of a mouthful, so oftentimes we refer to it as just HCTZ, chlorthalidone, and then furosemide is also in this category, but it's a little bit different, a little bit special, which is why it has an asterisk. So we'll talk about that in a minute. Diuretics decrease your blood pressure by increasing your urine output of water and sodium. So if you think of having fluid in a tube, if we just have less fluid in that tube, there's going to be less pressure. And so that's what diuretics are doing. Common side effect is urinary frequency. And again, the way that these medications are getting rid of that extra liquid is through urine output. So that's a very common side effect. Hydrochlorothiazide and chlorthalidone are usually the ones that are used specifically just for elevated blood pressure. And the effect on increased urination can be pretty mild for most. On average, I find that people might have to urinate about one more time during the day than they did previous to that medication. They are good for most as a first-line treatment. It also can help with water retention if you have swelling or edema in your legs, or congestive heart failure. And furosemide is also called Lasix. That's the one up top there that had the asterisks on it. We generally don't give that one specifically for high blood pressure, although it does lower blood pressure as well. But it is a common treatment for specifically swelling and edema, and as a treatment for congestive heart failure as well. It does cause significantly more urinary frequency. You're running to the bathroom a lot more with that medication than with the other two. So that's something to keep in mind. So things we want to be careful of with diuretics are a history of low potassium. These medications all can decrease your potassium levels. It doesn't mean you necessarily can't take this medication, but we may need to monitor it closely and recommend supplements if needed. Also, kidney disease, we have to be careful with, and it can also kind of exacerbate or make gout worse. It can cause gout exacerbations. It can elevate your uric acid level. So might not be the ideal first choice for someone with a history of gout. A couple other quick honorable mentions that I'll just list quickly are beta blockers. So things like metoprolol, atenolol. These can affect blood pressure. They're not considered first line. They don't have as much of an effect on blood pressure on its own as the other medication classes that we talked about, but they also work to slow heart rate. So oftentimes these medications are given to people either with heart failure or with abnormal heart rhythms, and as kind of an additional effect, they can also lower blood pressure, but usually would not be our first choice if we are giving them specifically for the purpose of lowering blood pressure without any of those other concerns. We have to be careful. Certain types of beta blockers can make asthma symptoms worse. So that's something to consider. The other medication I'll mention briefly is clonidine. That one's a little bit different in that it comes as a patch most often, and it actually works on the nervous system to kind of reduce your blood pressure and heart rate. Again, neither of these are considered first line. A big risk with both of these is something called rebound hypertension, meaning if you were to stop these medications suddenly, it can cause your blood pressure to spike, sometimes dangerously high. So with these medications in particular, and really any medication that's prescribed to you, before stopping, I would always talk to your physician so that you can make sure you're doing that in a safe way and you don't have any unwanted side effects. How should I take my blood pressure medication? So the first thing is regularly as prescribed. So most of the medications that we talked about are once daily. There's some exceptions, but most of them are usually once a day. And most importantly, they are not as needed. So again, most people don't have symptoms with their high blood pressure. So this is something that you're not going to take based on how you feel. You're just going to take every day. And also, I encourage people, if they want to take their blood pressure with like a home monitor over time, but it's not something that you might decide to take one day if your blood pressure looked high and not another day if your blood pressure was looking good. Okay. They usually take a couple weeks actually to kind of have their full effect, and they're not intended to kind of start and stop. Some of them, like I just said in the last slide, can actually cause spikes in your blood pressure if you stop them suddenly. So it's important to take them every day. And the second thing about how you take your blood pressure is with patience. So most of these medications do not act instantaneously. Usually, once you start a medication, they take days to weeks to have their full effect. And so it's very common, usually when we're starting a new blood pressure medication or when we're changing the dose, we will send you home with a new prescription and then ask you to come back in around 2 weeks to check your blood pressure again, because that's around the time that we would expect to see kind of the full effect of either that new medication or that dose adjustment. So just some quick final thoughts, and then we'll open it up to your guys' questions. So again, high blood pressure is very, very common. And while it's considered a chronic condition, there are many things that can be done, both through your lifestyle and through medication that can help control and improve your blood pressure and to prevent those long-term effects that we mentioned earlier. And just because you don't necessarily feel bad from your high blood pressure readings doesn't mean that it's not important to control. Again, every time your heart, that muscle is beating against a higher pressure, we're making that muscle work harder. And we don't want to, your heart is one muscle we don't want to wear out earlier than it should. So it's important to keep your heart healthy and to have it pump against a healthy blood pressure. And again, most people are asymptomatic. So it's really important to just get your routine checkups, get your routine physicals. Like many other health issues that we monitor on a regular basis, high blood pressure is usually easier if we catch it early. We can start talking to you about making these changes, lifestyle modifications, if we catch it early, and can kind of go from there. Okay, so I'm just going to leave this slide up for a while now. So you can see all of my my contact information, clinic address, phone number, and please enter any questions. And I think Amanda's going to kind of moderate this from here.
Yes, thank you for sharing all of that great information. So I'll start with the first one. What are the consequences of low blood pressure, and what are the numbers associated with concern for this condition?
So low blood pressure is usually very dependent on the individual. So concerning to me is if we're seeing regular numbers less than like 110, sometimes even 100 for the top number, or less than 70 for the bottom number. More importantly than the number itself, I think, is symptoms. So usually low blood pressure is associated with dizziness, lightheadedness, sometimes even fainting or passing out. And that's the most kind of important indicator of low blood pressure. So the numbers might vary in terms of what the actual numbers for an individual is, where they start having those kinds of symptoms, but that's generally the concern. So when we're talking about controlling high blood pressure, we're generally shooting to have you less than 130/80. And the reason for that is, even though that's still, higher than that 120/80 goal of like perfectly normal blood pressure, we also don't want to swing you too far in the other direction where we're causing some of those symptoms of dizziness, lightheadedness, all of those kind of things.
Okay, next question. What if the systolic number is high, over 130, but the diastolic number is low, under 80?
So you would still be considered to have high blood pressure. So it doesn't necessarily have to be both. So if your systolic blood pressure is still above 130, you would be considered to have high blood pressure. And so we would want to manage that either with diet and lifestyle changes or medication, so that both of those numbers are at goal.
The next question is pretty similar. Our attendee asks, what if your blood pressure, the systolic number is very good, but the lower number is very low, such as 120/60?
So 120/60, yeah, so 120 is good. That bottom number is low. I think that the main thing would be, to find out, are you having any symptoms of low blood pressure that we talked about, the dizziness, lightheadedness? Sometimes those low numbers can be associated with position changes too. If you've ever like stood up or sat up too quickly and felt dizzy, that's often because of a rapid drop in blood pressure that can happen when you're changing positions. But I would encourage you to go see your doctor, talk to your doctor about it. There's also other health conditions like heart failure, things like that, where we might see some lower numbers and actually want those low blood pressure numbers. And that's okay.
Okay. Is it unusual for a 75-year-old female who exercises regularly, does not smoke or drink, has normal weight, and eats healthy to have normal blood pressure?
I'm sorry, the first part of that question was, is it abnormal?
Yes, maybe she means, is it normal to have unnormal blood pressure?
So I will say, I will kind of answer it both ways. So I will say that I do see a lot of really healthy people in their 70s, even in their 80s, that, you know, have just led really healthy lifestyles and have never needed to take a high blood pressure medication and are doing just great. But I think kind of the flip side of that is also, as we mentioned, age is a big risk factor to developing high blood pressure. Also genetics, you know, family history, things like that. So if you're doing all of those healthy things, if you're, you know, not smoking, not drinking, exercising, you know, doing all of the great lifestyle things that we recommended, I never want people to take it as like a personal failing on themselves that they have a high blood pressure reading or that they need to be on medication. Because for some people, you can do all those things, and just because of family history or just normal changes that happen as we age, they still develop high blood pressure. So there's a lot of changes that you can make, but if you're doing all those things and you still end up with high blood pressure, you know, that's okay. We can manage it, and it's not always something that, you know, you didn't do enough or did something wrong.
Thanks for answering that both ways. The next question is chronic pain linked to hypertension?
So elevated pain level absolutely can increase your blood pressure. So chronic pain is a little tricky because obviously that's something that you're kind of dealing with long term. And so as while you're dealing with that, that can elevate your blood pressure reading, but with that, it would be kind of be part of your baseline. For more of acute pain issues, we can see more short-lived raises in blood pressure. So, you know, if I had someone walk into my clinic with you know, they just fell and broke their arm, they might have a high blood pressure reading because they're in a lot of pain because they have a broken bone or things like that. And then I might see them even a couple days later, and their blood pressure would be a lot lower. But if you're dealing with chronic pain, your readings can be elevated from that, but it's kind of just considered to be mixed in with those other baseline factors, because that's not something that usually fluctuates significantly with time.
Our next question is about medications. Do all blood pressure medications cause cough? And are there other medications that will not cause a dry cough?
Yeah, so only the ACE inhibitors, so only like the lisinopril, enalapril, though that specific class of medication are the only ones that are associated with the dry cough. And even then, it's not everybody that takes those medication that experiences that side effect. So the other types of medications that we talked about, the diuretics, the calcium channel blockers, even the beta blockers, things like that, none of those are associated with a cough. And if you do develop a cough with one of those ACE inhibitor medications, there's a really easy switch that we can do to one of those ARB medications like the losartan or the valsartan, where we can essentially get the same benefits. It works in the same way, on the same pathway in your body, on your kidneys and all of that to lower blood pressure, but no risk of cough.
What is the best blood pressure machine to buy?
So I don't think I have a good answer. Most of the ones that you get at the drugstore actually work really decently. So, um, you know, I do recommend if you can get one that goes on your upper arm, then your wrist. I find that those are more reliably uh, one consistent and more close to kind of what we get manually when we check in the office. But with any machine, if you ever have questions about how accurate it is or if you're using it correctly, a great way to kind of check it is to just bring it with you to your doctor's appointment, because then we can check your blood pressure with your machine, and then we can check it with our stethoscope manually and kind of compare the values, and also make sure that you're using it right and all of that.
The next one is, can you recommend a fitness tracker that monitors blood pressure?
So there's not, there's a lot of apps that are just health health trackers. Even on your iPhone you can track your blood pressure just like under the health application on your iPhone. So anything that lets you easily log your blood pressure, I think, is good. I know a lot of patients just even the Notes app on their phone. It doesn't have to be anything fancy. You can just literally record the numbers in a note, either on your phone or on a physical piece of paper, and that's an easy way to track it over time.
Okay, our next attendee asks, I take two different medications for blood pressure, a beta blocker and an ARB. Is that appropriate or harder on my arteries? Are there any disadvantages?
So I think, without knowing any of your other specific health information or things like that, I'm not going to comment specifically about whether that's appropriate for you. I think that's a good conversation to keep having with your own doctor about why you're on those medications in particular. But I will say that both of those medications work differently to help control blood pressure, right? So the ARB, the ARBs, kind of work on that hormonal pathway in your kidneys to block an enzyme that can dilate your blood vessels. And then the beta blocker slows your heart rate and can lower your blood pressure that way. So it is completely reasonable and safe for you to take those two medications together. But for the particular concerns of why those medications were chosen for you, or moving forward, I think I would need more information, and that's something that you would talk with your physician about. But generally speaking, those two medications are commonly given together.
Are there any medications that have been known to cause high blood pressure?
Yeah, so we when we were listing the causes of high blood pressure, that kind of long list, there are certain classes of medication. Some of the ones we talked about were stimulants. So remember any allergy medications that have like Sudafed or that D on the end, Claritin D, Zyrtec D, Allegra D. Those are decongestants that can cause elevated blood pressure. Steroids can also raise blood pressure, oral steroids specifically. So things like prednisone, or if you're taking like a Medrol dose pack, those can raise blood pressure. Weight loss supplements are also usually stimulants, and they can raise your blood pressure. And ADHD meds, so things like Adderall, which are also stimulants, can raise your blood pressure as well.
What is a normal blood pressure for someone in their late 80s? I have heard that blood pressure can be a little higher in the elderly and that it's not a cause for concern.
That's absolutely right. So I think this is why, it's something that is kind of based on your other health conditions. So when we give these general guidelines, they're just that, they're very general. So, there are some guidelines that say, 150 for elderly should be kind of our upper limit of when we should treat high blood pressure, because again, with low blood pressure, we run the risk of dizziness, falls, passing out, things like that, which for elderly people with mobility issues, if you're using a cane or a walker, anything we're doing that might increase your risk of falling or injuring yourself, we want to be really cautious with. But that being said, it really is dependent on what your other health issues are. Even if you're elderly, if you have congestive heart failure, we may actually have a lower blood pressure goal for you. So it's not always cut and dry, but you're absolutely right. There are some recommendations that for older individuals that top number is okay to be higher.
Okay, we're running a little short on time, so I'll just try to get through a few more. Our next attendee says, my blood pressure goes up and down during the day. Do you take your blood pressure more than once a day?
So I think, it's okay to take it more than once a day. You can kind of, if you're taking it at the same times every day, then kind of monitor it over time and see if you're seeing kind of similar patterns. For most people, it's not necessary to check your blood pressure multiple times daily. I think, taking certain days of the week or certain times to check your blood pressure is usually sufficient and fine. And obviously, coming into your doctor's office, making sure we can check that blood pressure monitor for you and that you're getting, accurate readings can be important. But it's normal for blood pressure to fluctuate during the day. Also, if you just had a cigarette, that's going to raise your blood pressure. Alcohol, if you just woke up, all of those things are going to affect your blood pressure. So it absolutely can vary throughout the day. So I wouldn't be too concerned with that.
Why does the blood pressure differ in a patient's arms? Should you use the lower reading or the higher reading?
So for most people, it should be about the same in both arms. There's some, medical conditions or things like that where it can vary significantly, but most often what we're seeing are just the change in your blood pressure over time. So oftentimes, when I have patients in clinic, sometimes they will have been in a rush to get to see me or running late for their appointment. And so we check their blood pressure the first time, or my nurse does, and their blood pressure is very high. And then, just sitting down for a couple minutes, they kind of relax, calm down. I check it again and their blood pressure goes down. So even if it's, on different arms, it's not necessarily that it was checked on a different arm, but more that they just kind of had the time to calm down a little bit. But, there are a couple exceptions of specific issues, specific vascular abnormalities that can cause differences in blood pressure in your arms. But usually it's some other factor that's causing those changes if you see them.
I hear foods like beets may lower blood pressure. Is this true?
Beets? Is that?
Yes.
Okay. I'm not familiar with beets specifically being a recommendation for blood pressure. That being said, they do certainly fall into the recommendation of, that DASH diet that we talked about, increasing fruits, vegetables, so absolutely that would be considered part of a healthy diet to control blood pressure. But I am not familiar with specific effect of beets in particular.
Okay. Are high blood pressure and high cholesterol related?
So both of them have effects on your cardiovascular health, but they're referring to a couple of different things. So blood pressure is that pressure in your arteries when your heart pumps, and then cholesterol is our concern with that is that it can form plaques. So it can kind of build up inside the walls of those arteries and cause, increase your risk for heart attack, stroke, things like that. So both of them are related to cardiovascular health. Both of them can increase your risk of heart attack and stroke. Oftentimes, some of those lifestyle changes that we talked about for improving your blood pressure will also help improve your cholesterol. So the DASH diet, eating more fruits and vegetables, lowering your dietary intake of saturated fat, exercising more, all of those help both blood pressure and cholesterol. Some risk factors for blood pressure, elevated blood pressure, also are risk factors for high cholesterol. So things like obesity, family history can also play a role for both.
What time of day should blood pressure be taken at home on a regular basis?
So I usually recommend midday as kind of a good, just like baseline value to have. So, I wouldn't do it like right when you wake up in the morning. And similarly, I wouldn't do it, like when you're laying in bed about to go to sleep, but kind of middle of the day, afternoon is a good time. If you do smoke, I of course encourage you not to smoke, but I wouldn't check it right after you had a cigarette or smoked anything. I think that's kind of the best mid-value baseline to have.
Can preeclampsia last for the rest of one's life?
So again, just to remind people, preeclampsia is a specific concern of high blood pressure during pregnancy that can pose a risk to both the fetus and the mother, and can lead to something called eclampsia, where the mom can have seizures and lots of bad effects. So preeclampsia is completely isolated to pregnancy. So we only refer to someone as having preeclampsia or eclampsia while they are pregnant. If you continue to have high blood pressure after your pregnancy, we would just say you had essential hypertension or hypertension. But the causes of that high blood pressure that result in preeclampsia or eclampsia are pregnancy specific. So oftentimes you have the baby and the issue resolves.
Okay, and one more before we end for the night. Can blood pressure medications cause constipation?
That is not a common side effect that I'm aware of. So I don't think so. Not commonly, at least.
Okay, great. Well, thank you, Dr. Manger, for answering all of our questions from our audience. And I would just like to remind our attendees of a few things. We will email a link to view this session on our website once the recording is posted. And to schedule an appointment with a UH provider near you, please call 216-998-1210. Or you can reach out to Dr. Manger's office at 440-794-2575. And this concludes today's session. Thank you for attending and have a good night.